All right, good morning. John Dombrowski at the Washington Pain Center. We're here together, and we've been doing caring for one another with the lumbar canal stenosis. And here's a video about patients who might have lumbar canal stenosis. You actually came to me a while ago asking for Vertiflex.
Yes.
And I did not want to give it to you. I wanted to try everything else. And we tried meds and we tried injections and they really weren't helpful or had side effects. So, when in doubt, listen to the patient. I finally said, okay, let's do Vertiflex.
Finally.
Right. And we did L3, L4. We did just one level at a time. You had several levels, but we did just one. And if someone's watching this video about Vertiflex, what would you tell them?
I'm very satisfied with Vertiflex.
Okay.
I've had friends, actually, I had a friend that had it, and that's how I got into this Vertiflex, because he's doing very well.
Okay.
So,
and if someone's watching this very well, so we were just talking a little while ago, but now that we have you on video,
yes.
Like your ability to walk or stand. So before you could walk maybe 10 minutes and had to stop.
Yeah.
And you were on like a little trolley or like a little walker, for your balance or whatever. What are you walking now?
I'm a lot better, and I'm transitioning basically to just the cane or sometimes with nothing.
Okay.
But when it's with nothing, I try to move slowly.
Okay.
Because
And
I'm still afraid of this balance.
right. And with respect to the longer periods of walking, are you walking longer?
Longer.
And how much longer now? You were 10?
Well, about 20 minutes.
So double.
Yes.
Easy. So, and how was the recovery aspect? That's the other thing we talked about, the procedure, how well you did. How was there a lot of pain afterwards? I didn't even ask you this one.
No. Well, actually, the next day after the surgery,
Yeah.
I felt a lot better.
Already? No pain, just felt better.
Much better. There's some pain, but it's on the incision.
Right.
I really didn't feel too much pain on where I was complaining about. On
Okay.
my back. So it's a lot better.
Okay, cool. So if someone's watching your video and wanted to learn from you, what would you tell them?
Well, if you have the same symptoms like I do, I think Vertiflex is a good alternative to basically laminectomy and fusion.
Yeah. And that's what you were told before.
That's what I was told.
And you're a little skittish about that.
Yes.
Good for you. Well, thanks for sharing your time. I appreciate it.
All right.
Thanks.